launching 6 News at 4.
Welcome back, everyone. We told you yesterday here at 4 about how this latest strain of the flu vaccine may not be as effective as in years past.
And, you know, since then, as you might imagine, we've received a number of questions from many of you asking what you should do to keep yourself and your kids safe. So we brought in an expert to help answer those questions.
Yeah, joining us right now, Dr. Ed McBride with Summit Medical Group. Doctor, good to have you here this afternoon.
Good to be here.
I guess the first question, really, as far as the CDC, kind of get us up to date on why they're saying this is coming out now about maybe this is less effective.
Well, every year we actually make an educated guess based upon past years and the virus that's been circulating in the community. That educated guess was a little off the mark, not because they guessed improperly, but we can't always predict how the virus is going to behave year to year. And this year the virus did change slightly. We call that a drift in medical terms, meaning that the vaccine we administer isn't spot on for exactly what's circulating.
Okay. Here's something that a lot of parents want to know. If their child has already had the flu missed, should they come in and get another dose of that or maybe a shot to go along with that?
They should not. At this point in time, it takes several months to develop a vaccine, so by the time you actually know what is actually circulating, it's too late to develop a new vaccine for that year. So future year vaccines will be based upon what we actually see circulating around the globe this year.
Okay. And really, this year's shot, I know when we first started talking about the flu shot, they were saying that this is really the best that we've had as far as protection from the flu in quite some time.
You know, a lot of things play a role in that. Number one, the number of folks that actually get vaccinated provide what we call herd immunity. Okay. So if enough folks actually get the vaccine, we protect one another because we don't spread it as readily one to another.
Right. And I wanted to touch on this. I know that on Facebook and other social media, a lot of our viewers and say, I'm not getting the flu shot, I never get it. I think there's a fear about the flu shot. People are worried that they will get the flu, and that's just simply not the case.
The flu shot actually does not cause influenza, okay, and it is your best protection against acquiring the virus. Secondary to that, obviously, practicing proper hygiene, washing your hands, covering your cough. If you are sick, stay at home. Don't expose your coworkers. Don't expose fellow students, classmates, that sort of thing.
Yeah, I know when someone comes down with the flu or even a cold at the house, it's you're wiping everything down. Trying to keep everything as clean as possible. Trying to, at least. That's right. That's the key, though. And that's really where it starts.
I think it is. Prevention is key, and after it's out, then we protect.
Right.
All right. When is the earliest you recommend getting a flu shot?
You know, the CDC recommended as soon as we start getting the vaccines in to go ahead and begin administering them. There is a little bit of drop in immunity over the course of several months. However, by the time we start administering in the fall, most of the time in the South, we see our outbreaks anywhere from Thanksgiving to early, you know, we can see early wintertime outbreaks. The latest I've seen, you know, April. So, you know, if you do it in the fall, you're getting 6 months of good coverage. So when you see your physician, whether it's in September, October timeframe, that's not too early to be getting the vaccine. And for those who haven't, you know, this vaccine is still a good vaccine. Right. Okay, and the type that we're talking about primarily circulating today may not be specific to the vaccine, but there are other subtypes circulating. So there is a degree of protection in what you get in the vaccine this year.
So go ahead. If you haven't gotten one, go ahead and get it now.
It's still a good idea.
Good stuff. All right. All right. Thank you, doctor.
My pleasure.
Appreciate your coming in today.